on the State Board of Canvassers' recent certification of the initiative to legalize smokable marijuana for medical use. And I oppose this measure because I find that it is unnecessary. The proponents, the Michigan Coalition for Compassionate Care, have misused medical studies in arguing that their measure is needed to treat symptoms in certain medical conditions. Prior to joining you here in the legislature, I worked for 5 years as a medical director for a hospice program in my district. I was board certified in the specialty of hospice and palliative care, and in this capacity, I made house calls and routinely treated the symptoms of dying patients. Occasionally, I prescribed medical marijuana, and I was able to do this because it has been legal to prescribe marijuana in pill form in the United States since 1986. This oral form of marijuana is known as Marinol, and it has a very narrow use profile. It is used mostly as a third or fourth line therapy to treat persistent nausea or as an appetite stimulant. And its use is limited primarily because there are much more effective medications available to treat pain, nausea, agitation, and loss of appetite. Marinol is, however, better than smokable marijuana because it does not contain the additional chemicals, impurities, or hazards associated with smoke. Also, the resulting blood levels from Marinol, and hence the effects, are much more predictable than with smokable marijuana. Now, the proponents have argued that smokable marijuana has a special use in the treatment of nausea because patients who are nauseated have difficulty swallowing pills. But recent technology has now given us topical anti-nausea medicines that can be absorbed through the skin. And there are at least 4 of these preparations, and they are all more effective than smokable marijuana. In addition, other delivery systems, such as an oral spray and a metered inhaler device, are being developed. Last year, the oral spray received FDA approval to begin clinical trials in the United States. So I'm telling you, as a former hospice physician, that it is of no benefit to legalize smokable marijuana because more effective treatments are already available. Additionally, if one reads the language of the petition initiative, you will see a reference to a 1999 National Academy of Sciences report. And that is given as evidence of the benefits of marijuana use. Also, the spokesperson for the coalition in favor of the petition initiative cites a report by the American College of Physicians as supportive of legalizing medical marijuana. I would advise you, colleagues, to read both of these reports. They are available online. Neither of them calls for legalization of medical marijuana. Both, in fact, call instead for more study of the effects of marijuana. The Institute of Medicine report, for example, says, and I quote, "Purified cannabinoid compounds are preferable to plant products, which are of variable and uncertain composition, whereas smokable marijuana is a crude delivery system that also delivers harmful substances." Likewise, the American College of Physicians report supports further research and states, and I quote, "It encourages the use of non-smoked forms of marijuana that have proven therapeutic value." Both documents then, cited by the proponents, actually support the position that the ballot initiative is unnecessary because marijuana's therapeutic use is limited, and in the instances where it is beneficial, a non-smoked form, which is already available, should be prescribed.